town and all the markets in Embu County. I think we are very much on course, and we are not going to let neither are we going back. The former government did so much into development. What makes you happy? You have very beautiful buildings and you have no medical care. People are dying. There's no medicine even as a result of very basic drugs which are affordable. So our dispensation is totally different. And when we are moving around, we assure the buildings that we are going to support you and you support us. What we want is partnership. We never came here to intimidate anyone. You want to do, you do our work, we do our work, and we motivate you. There are people saying that some of you are demotivated because of the contractual arrangement that you have. People getting different kind of wages. We are going to work on that, but you do your part. The CS has talked about pilferage. Even when kuchukua vitu ndogo ndogo kwa hospitali, that one we are not going to condone. Take that one to the bank. The other day when you were there saying that if you are not going to move as our norms as our nini, then afadhali kujitoa mapema kwa sababu hakuna haja tunaweka dawa hapa inapita kwa fence inarudi kwa kliniki za watu. That one we are not going to take. You take that to the bank. Personally, I've said that in fact I'll supervise our system of excellency to supervise how the drugs are getting here, how they are getting to the level 4, level 3. Nitakuja huko mimi mwenyewe ndio tuone kila kitu dawa iko safe na kila kitu iko sawa sawa. Okay, having said that, I think we're also going to work on systems to ensure that drugs in fact are safe. We need to digitalize hii mahali ikuwe sawa sawa. When you are moving around and went to the pharmacy, unaambiwa hii dawa sijui ni ya inpatient na hii ni outpatient. But how it gets there, that's another story. So the loopholes are there. So gentlemen, we are really support us because we mean well. We want to lead people who are healthy. Na utaki kujenga mabarabara na building kubwa sana kama watu wetu wanaendelea kufa. So support us in that one. In our manifesto, we also say that we are going to clean our town. Because the two health functions, the public health and the ingine, medical, zinabebana. When you have the flies and rodents in the garbage around this area, si hapo ndio korona inatoka na magonjwa mengine. So we are going to work on these two areas and ensure that we fix them before 100 days are over. So haya yangu ni machache, ni kusema mtuunge mkono na si tuunge mkono. Now it's my honor to invite Her Excellency our Governor Honorable Cecily Mbarire to come and give a speech. Karibu sana, Your Excellency.
Songe kitu kipite.
You may remain seated. The Deputy Governor, Your Excellency Honorable Kenya Mugo, our CEO of this hospital, Dr. Mugendi, CC, Ministry of Health, Chief Officer, and other officers present, the County Secretary, the entire medical workforce present. Ladies and gentlemen, good morning. Good morning once again. It's my pleasure to be here this morning and to officiate the first consignment, the reception of the first consignment of drugs and other non-pharmaceutical products from KEMSA to the level 5 hospital. I am glad that we have received this consignment because this hospital has had no drugs for quite a while, and a lot of residents of Embu County will come here and not get the necessary treatments. And we want to make this not just a one-off thing, but the normal and natural thing that must continue going on into the future. We do not need to have such functions to receive medicine or non-pharmaceutical products, or even to receive all other supplies needed in this hospital. We just need to see them coming, and we need to see people leaving the gates of this hospital healed and healthy to go and live a productive life. That is why we are here this morning. But as we do so, we must change the systems of how we've been managing supplies in this hospital. We must ensure that the medications we get, the non-pharmaceutical supplies we get, whether they are gloves or bandages or cotton or whatever consumable that we have, is used for the purpose it's supposed to be used and used within the facility of EMBU level 5 and not outside. And therefore, I want to give notice to those members of staff who've been assisting and aiding in stealing medical supplies from level 5 hospital to chemists and pharmacies and other private hospitals in Embu County. Your days are numbered. We will not entertain any form of theft, however small, and nobody is safe. If you choose to go that route, be ready to face the consequences. And there are no sacred cows in this hospital. You either work and work well and ensure whatever you're using is used well, or you choose to leave the hospital and allow those willing to offer services to the people of Embu County to do so. And so, may I urge and really plead with those that are working here, please do the right thing, and if you do, you'll not be in any trouble. But if you steal, if you do not provide the man hours you're supposed to provide, either as a doctor, as a nurse, a clinical officer, a lab technician, a radiologist, whatever level, a cleaner, a cook, a watchman, if you're supposed to provide 8 man hours per day, please do so that we can improve the services of this hospital. We are going to change a lot of systems just to make sure that we remain accountable to the people of Embu County. They want services, they want to come in here and get treated, and that is what I will ensure happens. So many changes are going to happen. I'm waiting for the task force report so that we can begin to make those changes immediately. I want to urge all of us to work together. Let us move together as a team. Let us make sure there is daily monitoring, and this is to the CEO and your team of management. We make sure there is proper monitoring of daily usage of medical supplies in this hospital, so that we know how many drugs are used, what is remaining, and even before those that are remaining are over, we make a new request for procurement so that there is no day we go without medical supplies in this hospital. We must change our systems, and I'm happy we are working towards making level 5 an independent institution that can run on its own and have powers to use whatever revenue that is collected, plow it back to the hospital so that we can improve on the services. So going forward, we will be seeking the support of our MCAs once they have been sworn in to allow for us to pass a bill that will make level 5 hospital a truly independent institution that will be run as a semi-autonomous institution of the government of Embu County, so that they can be able to manage their own accounts, their own revenue, and plow it back and depend on what it is they are able to collect. This hospital has a capacity of collecting anything between half a billion to 600 to 700 million a year. And we believe it is doable. So we are going to improve the services, make sure every department is working optimally, make sure the laboratory is working well. We still have some reagents that we have not been able to procure They were not available at KEMSA, but we'll make sure we get them elsewhere. We're in the process of procuring them from elsewhere. We still have a few consumables that are required in the radiology department. We'll make that possible so that going forward, no patient has to go out and pay more money if they can't afford it. They will do it right here at a cheaper cost. Allow me to speak in Kiembe. Kwa ukomode kuleta consignment ya mbere ya dawa cia level 5 hospital. Na turenda dawa icio itumike wega. Na turenda store ithingwe. Ninauka na padlocks cia kupinga stores. Na siya. Nigetha ucio rayaga agethie riu tumunyite na ni murona ni padlocks ya kiriu cia security na nie na deputy governor wa mundu agakoragwo na bungoro yake nigetha tugauka kuruthio resto ebana na ndawa iria ngumire ucio rayaga amenye mithenya yake ni ekatia ni athira ya kwira ndawa cia mwananchi na turenda wa muthenya ndagitari CEO Dr. Mugendi ugakorwo ukimenya ni ndawa iriku ciatumika muthenya mugima whether outpatient kana inpatient na record ikandikwa na ni tukuthie fully digital nigetha tuvote ku monitor uria ndawa irauka na irauma na chemist cia Embu County private chemist kana private hospital iria kanyitwa ikiendia ndawa cia thirikari iogeka thingwa kuguo kuma munthi muguraga icienyu na kumuguraga mutigecirie Embu County government ni akamusupplyaga na dawa cia kwenderia wananchi wanaria matarafundi titwitikira tabia mundu akanyitwa na chemist yake thingwe kuguo make up your minds. Number 2, laboratory ni tukuhakikisha dawa icio itanagurika cia ithimi tondu itira ikuo KEMSA ni ciagurwo within the next 2-3 days nigetha laboratory cietu ikorwo ikiruta wira fully nigetha nginya ukibewa ndawa cia antibiotic korwo imuthime na wamenyeka ni murimu uriku wina guo ukibewa ndawa icio na radiology department leo turende korwo fully functional x-rays MRI CT scans ikorwo ikiruta ikithondekwa guku na ndagitari agituma murwaru njaka dimwe kana agituma murwaru nja akavurwe mpisa ni tukenda kumenya kuma kwe uria urugamirite radiology department kana laboratory murwaru ucio atumwa nja ya thibitari ya Embu tondu ni ndu ikiratura na kiratura niki so from now on ugoro wa gutuma andu nja turendo thire no thire pio machine korwo ikiruta wira throughout utuko na muthenya tutirenda ugoro wa indo ciengi kwithagiriria andu maturaga nja ya Embu tauni na private hospitals magi makaribage goro na matina pesa cia kuriva uria ora fondi ni athie enda no ati ucio wa ukaba ni abewe matibabu kawaida na arigwe kuringana thogora wa thibitari na nuria waku afford bau vengi arutia wira mbere ya nginya barutia wira kwi ndawa ciengi igauka rucio na uke icio nacio ni iria ithiete level 4 na level 3 na level 2 hospitals nienda gucokera ukuo deputy governor auga cia kinya ikithirwa ma dispensary na health center na level 4 tugakorwa na andu wetu wa ofisi maga company dawa icio kuhakikisha ni cia kinya na ni cia receiver na cia sainwa ni nurse in charge kana ndagitari in charge kuhakikisha gutinda wa cia urira njirari na tukaroragia wa muthenya ku dawa icio iratumika mathibitari rimau na manasi aria marugamirite thibitari icio kana mandagitari merwe dawa ingi kaura wira waku ni waura uchoose kuiga wira waku na kuruta wira mwega kwi andu a Embu County na tutira ugo tukienda andu marute wira na guoya akorora ruta wira uria kwagiritwe ndwina bata ya kuinaina no tiga kora ni wise wina njara cia ngamu cia kwiyaya wambiria kuvanga tene winuke neo ni message nerende kinyire all the nurses and the CEC. I want you to write a memo to all the in charges across the county that going forward it will not be business as usual. If we make supplies available, they must use them in a transparent and accountable way. If they cannot account for what we've given them, then they're in trouble with my office. Arutia wira nao ni nirinde kumuteithia. Number 1, nitukuroria ugoro wa human resource kuringana noguo task force igutwira kuria turona kwina gaps kana gutaina mandagitari na nurses akwigana tuandike aria mandikitwe na contract tumate consideration ya mbere bauvenge pesa cionthe iria mutinekwe misarari yenyu na itana remitwa maroni menyu National Health Insurance NSSF kurekarante na tutume a supplementary budget yangu ikarande na MCS nimereigie dena ria ego ya health workers na workers all the county nigetha to repay all the pending and remitted deductions ya workers eto na nineko uguo mundethie na kuruta wira kithinyo bila shida yoyote na nitukumkorwa tukiruta wira very closely na county assembly kuhakikisha nitwave tukitia pesa icio nginya pesa cia kuhakikisha thibitari cietu ni cia soka back on its feet makina vota kwirugamirira going forward koguo icio nicio maunimo maundu maria nguvira mbere ya county assembly tugie na pesa cia kwigana tuvote gwika maundu mau na gwita na mwarithirwa pesa icio na twamuva an enabling environment tafadhali namwe muthiisage wira thaa iria cio no kauma thaa iria cio ukorwo wa guka wira ukaruta wira mathaa mairi thaa rimwe ukinaura tutashikana na wewe mahali kwa barabara ukitoka na twanyitana gaku ni gatoga niturutire andu a Embu County ndui wira na turute kithinyo katinda ni kariko maundu no nginya magaruruke. So I wish you well. You have my 100% support, my undivided attention to make sure Embu County changes. I promise you that. Idio nituragurire nibise gutira na idio. Daktari mugendi ambera ruku na idio. Lakini nitukugura rusia special diet andu aria maina thina ya mpigo, maina thina ya diabetes, nitukumake na cancer marie wega. Ndungiva mundu kithere na ina cancer akahabora. Wanginya tumuve special diet igatuma atia. Na suppliers aria matara ya rivenu ndu wa idio na indo ta icio nitukuroria bills icio tuone aria makuribwa mavote kuthii na mbere go supply nigetha thibitari ikoragwo na irio throughout. Kindu kingi tuthiite kuroria ni maundu megie uniform ya aruti a wira, mirengeti na bed sheets ya aria makoma, linen cionthe ni tukugura ciengi nigetha thibitari igaruruke. We'll look at linen. I'll ask the task force to look at what is actually required as a matter of urgency nigetha tugure na thibitari soke yaye na thibitari yaririte tene wanaoke ruta wira kuke gusaka wi kundu kwega kutheru na kundu patients maratirito wega kana atia. So I seek for your support. I will do anything nyawire kava barabara ciambe ciekare na wandu mere yao ethonde kwe kana atia. Hiyo itakuwa number 2, number 3. Priority number 1 is health, number 2 is health, number 3 is health. Once we've sorted health, we can do all the roads we want to do, we can put water, we can ensure there are classrooms, but for now, all my energy and focus is in the health sector. So asanteni sana, ninakena na nirenda kuga nitwareta antibiotics, nitareta dawa cia igekatu magirwa indo igekatu magirwa x-ray department wesio itaigo batwauga nakoro gutina films cia kuprinti du turenda images itumagwe electronically from one computer to the next. Daktari akarodia computer kona thina ririku akaprescribe treatment ya murwaru ucio. Twanginya kila kitu iko na film. We are going to go paperless, but we are still going to look for those. Make sure in the next couple of days we have films to make sure that we offer the necessary x-ray services. Tuina dawa cia cancer, andu aria maina mirimo ya cancer no amauke gukuru mathondekwe. Tuina dawa cia antibiotics mirimo ngurani dawa ciaba. Tuina dawa cia andu aria maina thina ya murimo wa high blood pressure, murimo wa diabetes, dawa cie guku na nitwoka na gloves, bandages, indo ta icio ciothe cie guku na cienge ni igauka rucio. Total value ya dawa ile twareta level 5 hospital munde ni milioni 19 na nirenda mbinguriro maroni maria ndorie ndari monekana ni twareterwa dawa kana ni athingu numerete ni marori matai kindu and ni confirm nigetha to make sure things change. I wish you people well. Dr. Mugendi, I'm wishing you well as you try to turn around this hospital. You have my full support, and please work closely with the task force that we have put together under the able leadership of Dr. Kimani. Please work closely with them. Let us know what needs to be done so that we can turn around this hospital and turn around the health sector in the entire county. Ningukora visit level 4 hospitals, ningu get to level 3 hospitals, ningu visit a few dispensaries, ningi muno, but I'll go across the sub-counties, visiting all those health facilities. Nige tako te kuigwa first-hand challenges yao. Timbe terata sposireta report wanani ningu die neonere na neigwire. Nige kama kimbira mambire wanani nekiatia neonerete. Kaiwa moya murakine. Thank you very much. So now let's go and look at what is here.
Issue of padlock and the private hospital in Kiswahili.
Nimenunua padlocks za kufunga mastore mahali tutaweka hizo dawa. Na nitaweka funguo moja mimi mwenyewe ni bebe. Na tutakuwa mimi na deputy tutakuwa tunakuja tunajiangalilia, tunafuatilia vile hizo dawa zinatumika kila siku. Ndio wale wezi wamekuwa wakiiba dawa zetu wanapeleka kwa private chemists and pharmacists and hospitals. You are now warned, your days are numbered. We will not allow you to steal from our people anymore going forward. Asante.
Yes, Madam. Yes, Your Excellency. This particular truck, these are syringes. These ones are examination plates. So we need This is also carrying a containment of a fuel and pharmaceuticals, bandages, the cotton gauze, and others. Particular truck is carrying IV fluids. You realize that we cannot be in a position to function without normal saline and other fluids. So for this one, if you give so that at least you can also get see it has a little bit of some antibiotics.
These antibiotics, eh?
Some antibiotics. This one is
asthma.
asthma.
That's it, you know.
For allergies.
Allergies.
Yes.
This one is a cream. Okay. Thank you. Thank you. And finally, we have some antibiotics here. Okay.
Good.
Yes. Very well.
They are packed in 1, 2, 3, 4, 5.
These antibiotics, yes, toxicity. Yes.
Sawa sawa. So it's a gift to Embu County. So,
It is to your county, to your government. Yes. And we appreciate your support.
So this and this are gifts.
No, this one is part of the consent. We wanted you to get a verification of
What is inside?
Part
Oh, okay.
we say we are just cartons.
Oh, okay. Okay. Very well, please. Thank you. And then what? Pressure migani?
This one.
Nothing. This is for pressure.
Epilepsy hapo.
Epilepsy iko.
Kuna shida ya kichwa kama kuwa depression.
Good.
Very good.
So when do we expect the county consignment to get here?
Hopefully tomorrow. The other level
Right now. Yeah. Yeah. Tomorrow by morning we will be back. They're confirmed.
Okay.
Yeah. So tomorrow morning.
Ameweza kuandika kazi zake ambazo aliwaahidi wananchi katika kaunti hii ya Embu kwamba siku za kwanza 100 atatekeleza mambo ya afya, jambo ambalo ni kweli limeanza kuonekana na wananchi wa Embu, ambapo wananchi walikuwa wameteta kwamba hakuja kuwa na madawa katika hospitali, na pia kumekuwa na tetesi kwamba kuna baadhi ya wahudumu wa afya wamekuwa wakipiga chenga wananchi na kuuza madawa hayo katika hospitali za kibinafsi ambazo hatutazitaja kwa sasa. Siku ya leo tumeona kuna lori 3 na ni lori kuu ambazo zimekuwa zimeleta dawa, ni malori 4 ambayo yameweza kuleta madawa katika hospitali ya rufaa ya kaunti ya Embu. Lakini kwanza tutaenda moja kwa moja hadi kwa gavana Cecily Mbarire ambaye yuko na pamoja na sisi. Gavana, siku za kwanza 100, tumeona siku ya kwanza baada ya kesi kukatwa umeanza shughuli muhimu. Umefikiriaje mambo ya afya kwanza badala